All right, welcome everybody. Today we're going to talk about common injuries in the over 50 plus population, tight areas, common challenges. You may resonate with some of these things. And why is it so important to find somebody that understands you versus just doing some YouTube videos, training at the local boot camp? Sit back, enjoy this podcast episode. We're going to dissect this, go into it. I think you're going to enjoy the show. So, I've been working with the 50 plus population for, over 25 years since I got started at a very young age. I'm approaching 50, 19, 20, 21 years old. Until now, I've been working with this population. And there's some common um, myths that people don't understand, especially those younger trainers. Unfortunately, there's a lot of people out there that want to help people, want to make a difference, good people doing good things. But the average 22-year-old trainer doesn't understand the 50, 60, 70 plus population in terms of injuries, tight areas, compensations. And unfortunately, people will look at, let's say, a 50-year-old individual, that person's 22, and they don't see the cautionary tales, the life experiences of the different injuries. And the reason being is they're younger, they're 22, they don't know the difference. So let's just, for starter's sake, talk about common challenges that people deal with when they're 52 versus 22. When you're 22, your tissue is typically pretty healthy. Your discs, your joints, your body heals at about as quick a rate as it's going to heal. You can get nicked up from time to time. You may not have the best diet, but the body kind of makes up for this. And I've heard a nice quote for Sylvester Stallone kind of talking about this is when you're young, you can get away with it. As you get older, it can get more challenging. But in this population, if you're over 50, things that you may deal with frozen shoulder, bone spurs, calcium deposits, degenerative disc disease. You may deal with osteoporosis, osteopenia. You may be losing bone density. Literally, you're losing density of your bone. Obesity, so weight gain. And maybe the weight gain has increased a lot for you in the last few years. Diabetes, okay? Diabetes, type 1, type 2, heart disease, inflammation of your joints, arthritis in the body, where the joints are actually not only inflamed, but they can also be rheumatoid arthritis, fibromyalgia, psychological problems, just maybe depression, which is not uncommon, muscle loss. I mean, we're losing muscle. This is kind of the elephant in the room, is that as we age, we're losing muscle each year, and it escalates and increases when we get to about 45, 50, it speeds up. So you're losing muscle faster than you're rebuilding. And a lot of times we don't even know it because we may be gaining weight and we're gaining fat where we had muscle. So reversing that as a challenge. But these are knee problems, knee replacements, degenerative hip, ankle issues, neck, compression of your disc space, which used to be like this, is decreasing in space. You may have breaking down of your shoulder joint, the labrum. You might have a little tear in your labrum or in your hip. This is a long cautionary tale of issues, but here's why I bring it up: is if your trainer is training you like you're 22, if they're training you like you are in perfect movement shape, you're going to actually be more predisposed to injury. So we look at it very differently. And I'll show you this, is that when we look at your posture, when clients come in, we analyze clients' posture as a key metric, and then we analyze movement. But when we're looking at posture in specifics, we're really seeing how does the body line up? Because this is a real key important factor is, are you lining up ankle, knee, hip, shoulder? Is everything stacking? Okay. From a vertical standpoint. And then horizontally, ankle to ankle, knee to knee, hip to hip, shoulder to shoulder. If I had a side view, I would want from a side view, ear, shoulder, hip, knee, and ankle to stack. And if that's happening, then I'm in the power posture. Typically, I'm going to have the proper curve in my neck, in my mid back, and my low back. So it's very important that I am able to compare what your posture looks like right now at 52 and maybe degenerative disc or some different injuries, that I'm taking a snapshot of your overall posture. I'm looking at your movement, and then I'm going to create a program to best fit your needs. And if we look at um, what kind of one of the culprits of sitting is going to be um, losing that overall postural position. So when we're looking at this from a side view, ideally you may be spending hours and hours sitting. Most people do in their job, but here's the unfortunate part, is that if you're spending time sitting, you are losing that lumbar curve that you're supposed to have. You're supposed to have that a little bit of an arch in your low back. That arch flattens out, and typically hips tuck under. As hips tuck under, you compress your discs. Those disc space decrease as you are tucking your hips under. We typically get more rounded in our upper back, and that head tends to come forward. Now, you notice this guy here, thanks to Chat GPT, is nice and tall, and he's pretty stacked in terms of ear, shoulder, and hip, which is great. Nobody sits like that. I mean, literally, 1% of the population sits like that. This is a guy who understands posture biomechanics, and he's really trying to sit tall. He's getting some activation of the muscles in his core, in his low back, erector spinae group. He's got his head stacking well. He's looking downward. So why do I bring this up? Because your posture, the tasks that you are doing on a daily basis, be it sitting or it could be being active, cause our body to compensate. And the more that we compensate, the more we run into injuries, the more that we run into problems. So when we look at this from, a overall alignment of the body, it's really important that we are looking at your posture, looking at your movement, and looking at your health history, specifically this long laundry list of different injuries that I talked about in the over 50 plus population. It's not uncommon that you have 1, 2, or 3 of these things. And the person that's working with you really needs to hone in on improving your posture, improving your movement, and then the strength training needs to strengthen better posture and better joint range of motion. When unfortunately, oftentimes, if we're just doing bro science and lifting hard, we are probably strengthening dysfunction. So you want a trainer, you want a coach that understands these components when they work with you. And they understand specifically your health history as well. Maybe you had a torn meniscus in your 20s that still kind of bugs you in your 50s from time to time. You may have a degenerative hip. You may be wearing out your hip. And it's important that we're not doing a ton of grinding exercises that are going to put excessive force right on that degenerative hip, that we're actually doing things to level out your hips so that your hips are balanced, so that we can maximize the spacing in your hips, so we're not going to tear your labrum. Just that covering inside of your hip, that tissue, it's really important that it's moving as smooth as possible, that we're doing exercises to promote balancing your hips and getting your hips and the femur head and that socket to move nice and smooth, rather than doing things that actually could escalate and speed up a potential surgery. So these are the key kind of components we look at before we train clients. And it's really important that a trainer has experience with looking for these, hot spots, these potential caution flags that pop up, stop signs that pop up, and that they're able to actually take your feedback. You may say, hey, this is kind of bugging me. No problem. Let's take this exercise out. Let's do this exercise, which is going to promote more balance at this specific area, and then move forward. So you really need a higher level of expertise. And that's where the YouTube, the TikToks, those things, unfortunately, are not going to be customized to you. It's good general information. Actually, I'd say it's great general information a lot of times, but sometimes it's going to be very contraindicated. But you want to find somebody that understands you at your age, where you are, past health history, and then customize a program to meet your needs. So hope this helped. This is working with that over 50 plus population. There's nuance, there's specifics to it. And I would say it's not easy, but it's actually very doable if you have the right person guiding you along the way. So those are some tips to look for. Thanks for watching, everybody, and I will see you in the next video.